Hello friends, welcome to our channel Medicoistic. Fall in love with medicine. So today's our new topic is on humerus. Yes, of course you know that humerus is a part of upper limb, right? It is long tubular bone which consists of body, or you can say shaft, right? And two endings. Two ends. Ending ends. Okay. The first is upper and the second is lower, or you can say superior or inferior endings. Now here I will draw a diagram on the of the humerus so you get to know everything. So here is our tubercle, this is our sulcus. Okay. Okay, so this is humerus. Yes, I know it's a short diagram. I will show afterwards a whole diagram rapidly. Okay, so first thing, this is superior part, or you can say upper part, and this one will be the inferior part. So superior part consists of caput humeri, matlab head of humerus. Okay, the thing that I want to know, get to know that how you will understand that this is superior part or this is inferior. It's easy. The round part, which is known as caput of humeri, or you can say head of the humerus, is superior, and the small, like, it's inferior. Okay, now this is tuberculum majus, it means major tubercle. I am writing in Latin, tuberculum majus. Okay, and tuberculum minus. Majors means major, minus means smaller. So how we will justify that tuberculum major is which side and tuberculum minor is which side? Okay, so you can see that the small round, you can see, this is known as foramen nutricum, is the side of tuberculum minus. Or if you don't get by this way, then here you can see a small round, it is known as capitulum. Okay, so the area where the capitulum is located is the major part, tuberculum major, and the area where foramen nutricum or the slined part, as you can see here, this part. Okay, that side will be the tuberculum minus, and this part is known as Epicondylus medialis. Okay, so one thing that I want to know, I want to try to show you, is that this part where the tuberculum minus is located, this part is medial part. Okay, and this part where capitulum or tuberculum major is located, this is lateral part. And if you forgot that which is medial part, which is lateral part, by this, then you can see that the caput humeri will join to the scapula. Here is the medial part, and the part which is not connect with the scapula is the lateral part. Okay, now after this, I want to show you is that this one, this slant one is known as trochlea. Okay, and this you can see a tubercle here, a big tubercle. This is known as tuberosity deltoides. Why this name is deltoidea? It is because here the muscle of the humerus will be located. That's why. To know about the muscles, you will get to know soon about the muscles in next video. Okay, so here we will have tuberosity deltoid or deltoid tubercle. Now the part that is formed between tubercular majus and tubercular minor, okay, this is known as sulcus intertubercularis. Sulcus intertubercularis. How you will remember this name? As you can see that it is found between both the tuberculars. That's why it is known as tubercular sulcus intertubercularis. Now, if there is a head, then there must be a neck. So this part from here to here, okay, this part is known as culum anatomicum. Culum anatomicum means neck of anatomy, like neck of humerus. Okay. Now the most important thing that you have to see here, and the mostly asked question is that where is culum surgical is found, or you can say surgical neck. This area from here to here, our surgical neck will be found. Neck, and the Latin name of the surgical neck is known as culum chirurgium. Mostly the teacher will ask about the surgical neck only. If they asked about the Latin name, then culum chirurgium. Okay, then yes, then the important thing is left. There are two fossas left in the humerus. Is that the first fossa is here, and the second fossa will be here. Okay, so first fossa is known as fossa coronoidea and the fossa radialis. How we will remember these names? By the coronoidea, by the corona, of course, and radialis means radial bone. It will be the next bone of the upper limb only. So you have to remember like this. There are two fossa, fossa coronoidea and the fossa radialis. So this is all which we found in the anterior part of the humerus. Okay. So I will repeat once again for you that the cap-like structure, wait a minute, yes, the cap-like structure is known as caput humeri. If there is a cap, then there must be a neck. If there is a head, then there must be a neck. So the culum anatomically. But we have one more neck, is known as surgical neck. The mostly question asked that why surgical neck? Because it's a common site for the surgery and common site for the fracture of the humerus. That's why this is known as surgical neck. The big tubercle, here we will have big tubercle, and here we will have small tubercle. The big tubercle is known as tuberculum majus. The smallest tuberculum is known as tuberculum minus. The sulcus that found between the majus and minor is known as sulcus intertubercles. This part is medial, this part is lateral. There is tuberosity deltoid, because deltoid muscle will be found in humerus, and foramen nutricum is a foramen, where all nerves, arteries and veins will be go here to supply the muscles bone of the upper limb. Okay, now there is epicondyle medialis, then there must be epicondyle lateralis. Here will be the epicondyle lateralis, sorry I have not mentioned here. Then that will be capitulum, trochlea and two fossa, coronoidea and radialis. Okay, now I will show you this in the big diagram. Here we have the diagram of the humerus. Okay, so if you want to take screenshot, you can take here, and it's a quite good diagram of the humerus. Okay, now I will make you understand the posterior diagram of the humeri. It's also the part of the humerus. Okay, here will be the tuberculum majus. As you can see, a bump like area, this is known as tuberculum majus. Then here backside will have tuberculum minor. You can see a cap head, this is known as caput. This is culum anatomical culum, and here you have the surgical neck, this is known as in Latin. Okay, now there is sulcus nervi radialis. Here will be radial nerve will be passed. Then facies posterior, facies means posterior surface, margo lateralis and margo medialis. Okay, now you can see here two epicondyles, lateral and medial, as I show you in the last diagram. Okay, and if there must be a sulcus nervi radialis, then there must be sulcus nervi ulnaris, because the radial bone and ulnar bone will be found in the forearm, so there must nerve and arteries will pass from the humerus to the radial and ulnar, so there must be a sulcus for radial bone and sulcus for ulnar bone. Okay, then we have trochlea, but we found one more important thing in this diagram is known as fossa olecrani. Okay, it is the important fossa of the humerus. So we have the three fossa. Okay, fossa coronoidea, okay, fossa radialis and fossa olecrani. Okay, so the important about this diagram is nothing but this fossa, because this fossa will attach to another bone. That's why this fossa is important. So here is all about the humerus. So now it's time for the MCQs. So hope you like this video. If you like this video, then hit the like button, comment us in comment section the next topic, and subscribe our channel and press the bell icon. And if you want to know more about the diagrams MCQ related this topic, then join us on Instagram Medicostick and on the Telegram by the Medicostick, and we have WhatsApp group too, so hope you will join there and ask some question related to these topics. Thank you.